York can introduce us to all kinds of eccentricities among humans. Whether you see a girl who has green dreadlocks or a man who runs around in a cape, living here has certainly equipped people to let daily oddities slip under their radar. But what if you saw someone walking down your street talking to themselves or having a hallucination? What if you suddenly noticed they're walking directly behind you? Would you walk faster? Is this person just a psycho? Approximately 1% of the world suffers from schizophrenia. Why is this psychological disorder so off-putting? How does the way in which we accept and embrace cultural and individual difference relate to the world of mental difference? What really defines a psychological disorder?
When I'm working with people who have psychological disorders of one sort or another, I sometimes ask them how well their strategy for living is working for them. And generally speaking, of course, the answer is not very well, because that's why they're seeing me in the first place. So I'd say that it's anything in the way one is using one's mind to regulate one's life that isn't working, that isn't getting you what you want.
The DSM-3 is basically, or actually that's DSM-4, is the sort of the Bible for how we classify disorders. Basically, you have behavior, affect, and cognition. So disorders of any of those three major areas would be then how we would define mental illness.
Given this medical approach to understanding the psyche, what can be said of the biological and psychological symptoms of a disorder such as schizophrenia? How can we understand a condition that pop culture has diluted to the point that it has almost lost its true meaning?
Basically, it is a psychotic disorder. It's an excess of dopamine re-intake into the brain, which is what causes actual schizophrenia, which is why it's basically treated with pharmacology. Drugs that block the reuptake of dopamine back into the brain seem to be the best in working with schizophrenia. But in terms of psychological manifestations of it, again, if you kind of think in terms of those three separate areas, cognition, it's a thought disturbance. Often there's delusions of grandeur, delusions of paranoia. Sometimes they take on a visual hallucinatory state. Most of the time it's auditory hallucinations. Kind of goes beyond hallucinations and delusions, though. It really is kind of a cognitive disorder. Behaviorally, sometimes, and not all, but some schizophrenic patients will have a difficult time in social situations. Again, my personal opinion is that it's really not a social disorder as much as they're having problems with social interaction because of the cognitive disorder. If you can't even trust your own thoughts, how are you going to interact, in a natural social setting? Which kind of makes sense when you think about it. If you're not sure who to trust, if you can't track your own thoughts, it's hard to follow conversations when you're trying to listen to somebody else and you're listening to a whole thought process going on within your own head. So there is that behavioral component, but I think it's probably the lesser of the three areas. And in terms of affect is just a psychological term we use really to mean emotion. The affective state is usually like a blunted affect. Sometimes there's like an anhedonia that goes with it, which is like a loss of pleasure in previously pleasurable activities, just sort of a loss of interest in life. But in general, it's more of just a blunting of affect. Although, when you do see the emotion, it tends to come out as almost a violent anger. So it's often hard for family members and other people to understand how there could be no affect and almost no emotion. People tend to say, oh gee, she's depressed, or he's depressed, or like I get nothing out of him. And then on the other hand, like that, a schizophrenic patient can just go off and become really irrationally angry, and then it just stops. Sometimes as early as it starts, it can just stop.
But schizophrenia isn't just one illness, it's a syndrome, meaning a group of related symptoms, which nevertheless may constitute more than one actual disease. So that, for example, people sometimes speak of the schizophrenias, just like we speak of the cancers, the different forms of cancer. All the cancers have some things in common, which is why we speak of them as cancer. And yet there also are real differences, between the different types of cancer. And we also know that they have different causes and different cures.
Regarding treatment, drugs are difficult to administer to schizophrenic people since many of them do not even realize that their disorder is real, a condition known as anosognosia. So where do families of schizophrenic patients turn during times of emergency? The mental hospital has only been around since the late 18th century, but it quickly gained a bad reputation as an institution for the criminally insane. Today, mental hospitals have certainly improved. Coupled with other therapies, some families consider them to be safe havens for a schizophrenic relative they can no longer attempt to treat themselves. But just how effective are they?
Even though it's costly, I think inpatient treatment is really necessary for patients. The biggest problem with treating schizophrenics is that they don't want to take their medication. You know, they'll take it for a while, but they just don't want to take it. And then, of course, you know they're going to relapse because it is a biological disorder, something within them that they can't help without the medication. So I think unless you can put them in a hospital where they're monitored completely and basically almost forcing them to take the medication, you're really not going to have much luck. Here's the best way to take it. You know, you get the flu, or you get, you know, a bacterial infection, and you go to the doctor and they give you antibiotics. And how many of us get the antibiotics for 10 days, and after 5 or 6 days we feel better, and we forget to take those last few days? I mean, that's the best example I can give. As soon as we feel better, we don't want to take drugs. You can't blame people, and that unfortunately is what happens in the case of schizophrenia.
Excessive use of hospitals can do as much harm as good. That is that if people are kept in a hospital longer than they really need to be there, what can happen is they are likely to regress to a much more kind of dependent, passive, childlike state where they just, you know, expect to be taken care of all day and really don't do much on their own. People have coined the phrase or the word hospitalitis or hospitalism to describe that syndrome.
Given all the mainstream knowledge of the subject, what are some misconceptions about schizophrenia? And how do our misconceptions affect these patients?
People often misconstrue multiple personality with schizophrenia. A lot of times people think that schizophrenics are dual personalities or multiple personalities, and that's not so. That's a completely different, you know, disorder.
One, I would say, is probably an exaggerated fear or a mistaken fear of violence from someone who's schizophrenic or has any other major mental illness. In fact, the most careful studies that have been done on that subject determined that people with major mental illnesses were no more likely than other people to commit any kind of serious violence against others. One exception to that is that we do need to be aware that there is a much higher than average risk of violence toward the self, that is suicide. I think people have said that, perhaps as many as 10% of individuals suffering from a schizophrenic illness will eventually commit suicide.
I think probably the biggest perception is that people are crazy. You know, whenever you see down and out people on the street, walking down the street, mumbling to themselves, screaming, acting irascibly, everyone always say, "Oh, she's schizo. He's crazy. He's psycho." And it's not true. I mean, it's a biological disorder. People can't help it, you know. And I think that's probably the hardest thing for the average public to understand is it's nothing the person did that's their fault. It's just something within their biological makeup.
Despite the feelings of alienation that can accompany these misconceptions, unfortunately, some mental patients in America face a much worse fate.
One of my colleagues said the largest mental hospital in the country is the Los Angeles County Jail. And he was right. There were more mentally ill people in the Los Angeles County Jail than there were in the mental hospital. I'd say the majority get sent there for relatively minor, often nonviolent crimes. Not pay the toll in a toll booth in a turnpike. I mean, just things like that are so trivial it would amaze you. People can get sent to a jail or a prison for that kind of thing. Then, if they're lucky, there will be a mental health staff in place who will be able to diagnose and treat these people while they're there.
It's strange to think that in our seemingly advanced country that we could act so harshly to people with a biologically disorganized thought process. These people could be living right on your street, and yet they're not your neighbors, they're just schizophrenics. When did a schizophrenic person become just a patient? Doesn't this isolation only perpetuate feelings of alienation someone with this illness may already have? It is clear that what people with schizophrenia need is not pity or avoidance, for this implies that a schizophrenic is a strange, incomprehensible object rather than a person. What they do need are community centers and hospital staffs that can assist them in feeling less like patients and more like human beings. And for this to happen, they need society to at least try to understand the realm of biological disorders. But until these things can be attained, and as cliché as it may sound, the best treatment may be in the irreplaceable and free of charge love and support that a community can give to a schizophrenic person. But who knows if our supposedly advanced civilization will ever progress that far?